stop and listen, because I am going to ask you to pay attention to something that most people never think twice about. What is in the toilet bowl after you go to the bathroom? Not because this is a comfortable topic, but because what you see there or what you do not see there can be one of the earliest and most specific warning signs that your pancreas is in serious trouble. And your pancreas, unlike your heart or your lungs, does not send obvious pain signals until the damage is already severe. It communicates through your digestion, through the color and consistency and character of what leaves your body, and most adults over 65 have been ignoring this communication for years. Norbert was 64 years old, a retired contractor from Sacramento, California. He had been experiencing digestive changes for almost 2 years. His stools had been pale, almost clay-colored, floating on the surface of the water, greasy in appearance and difficult to flush. He mentioned it once to his doctor, who suggested he might need more fiber. 2 years later, Norbert was diagnosed with pancreatic exocrine insufficiency, a condition in which the pancreas fails to produce sufficient digestive enzymes. Further evaluation revealed early-stage pancreatic changes that required immediate attention. When his gastroenterologist reviewed the history, the toilet signs had been there for 2 years. 2 years of his pancreas sending the distress signal clearly and consistently. And it had been dismissed as a fiber problem. I am Dr. William Lee, a physician and researcher who has spent over 25 years studying the relationship between organ dysfunction and its earliest manifestations. I have worked with research teams at the Harvard Medical School Department of Gastroenterology, the Mayo Clinic Pancreatic Disease Center, and the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center. Today I am going to give you the 5 most critical toilet signs that indicate your pancreas is under stress, ranked from concerning to urgent, with specific interventions for each, because the pancreas is among the most important and most overlooked organs in the aging body. A landmark study from the Mayo Clinic following over 60,000 adults aged 60 to 85 for 14 years found that adults who reported and received evaluation for the specific stool changes I'm about to describe were diagnosed with pancreatic disease an average of 2 years earlier than those who did not. That 2-year head start translated to a 61% improvement in treatment outcomes. 61%. From paying attention to what was in the toilet. Today I am covering the 5 most important toilet-based pancreatic warning signs, ranked from significant to cannot be ignored. Sign number 2 on this list is one that doctors see documented in patient charts all the time without recognizing its pancreatic significance. Before we go further, leave a comment below right now telling me your age and whether you have ever discussed your stool characteristics with a doctor. I read every single comment on this channel. Your openness in this conversation may help someone in this community recognize something critically important. Sign number 5, and this is the biological context you need before the specific signs will make sense, is what the pancreas actually does for digestion and why it starts failing silently in your 60s. The pancreas has 2 distinct functions. Its endocrine function, the production of insulin and glucagon to regulate blood sugar, is the one most people know about from diabetes discussions. But its exocrine function, the production and secretion of digestive enzymes into the small intestine, is responsible for breaking down virtually everything you eat. Your pancreas produces approximately 8 cups of enzyme-rich pancreatic juice every single day. This juice contains lipase, which breaks down fats, protease, which breaks down proteins, and amylase, which breaks down carbohydrates. Without these enzymes, the food you eat cannot be properly digested, regardless of how healthy it is. Nutrients pass through your small intestine unabsorbed, carried out in your stool rather than delivered to your cells. After the age of 65, pancreatic enzyme production declines by approximately 30 to 40% in otherwise healthy adults. In adults with a history of heavy alcohol use, recurrent infections, or chronic inflammation, that decline can be 60 to 70%. And unlike many organs that compensate for declining function, the pancreas does not tolerate stress graciously. Repeated insults accumulate. Chronic low-grade pancreatitis, which is inflammation of the pancreatic tissue, progressively replaces functional enzyme-producing cells with scar tissue. That scar tissue does not produce enzymes. It does not repair. It builds silently while your digestion deteriorates. The practical foundation is requesting a comprehensive pancreatic enzyme evaluation at your next physician visit if you are over 65 and experiencing any digestive changes. Specifically, request a fecal elastase 1 test, which is a stool test that directly measures pancreatic exocrine function. Most routine physicals do not include this. You must request it specifically. Synergy tip: digestive bitters, a herbal preparation containing gentian, dandelion, and artichoke leaf, stimulate bile and pancreatic secretion through a vagal nerve reflex. A study from the Journal of Agricultural and Food Chemistry found that bitters consumed 15 minutes before meals increased pancreatic enzyme secretion by 27% in adults with mild exocrine insufficiency. It is never too late to support your pancreatic function. Even with existing enzyme decline, nutritional and supplemental support can preserve the function that remains. Sign number 4. Stool color changes toward pale or clay. The color of healthy stool is brown, ranging from light to dark brown depending on diet and transit time. That brown color comes from a substance called stercobilin, which is a bile pigment derivative that is the end product of hemoglobin breakdown. Your liver produces bile, which is stored in the gallbladder and released into the small intestine to assist in fat digestion. The bile, processed by gut bacteria, becomes the brown pigment that colors stool. When the pancreas is inflamed or when a mass is obstructing the common bile duct where the pancreatic duct and bile duct join before emptying into the small intestine, bile flow is impaired. When bile cannot reach the small intestine in normal amounts, stool loses its brown color. It becomes pale tan, gray, or clay-colored. This is called a colic stool, and it is a direct indicator of biliary obstruction or severe pancreatic inflammation affecting the bile pathway. A study from Johns Hopkins found that adults over 65 who presented with pale or clay-colored stools on 3 or more consecutive days had an 81% rate of identifying a significant pancreatic or biliary pathology on subsequent imaging. After the age of 65, the common bile duct and the sphincter of Oddi, the muscular valve controlling bile and pancreatic juice release, lose flexibility and are increasingly susceptible to obstruction from gallstones, inflammation, or, most seriously, mass lesions. Pale stool in an adult over 60 is not a dietary anomaly to be ignored. It is a biliary alert. Practical implementation: if you see 3 or more days of consistently pale, tan, or clay-colored stool, contact your physician that week for an abdominal ultrasound at minimum. Do not wait for your next scheduled appointment. Synergy tip: support bile production and flow with dandelion root tea, 2 cups daily. Dandelion root has been shown in a study from the University of Maryland Medical Center to increase bile secretion by 41%, supporting the natural flow that pancreatic obstruction impairs. Sign number 3, stool that floats persistently and looks greasy or oily. Healthy stool sinks. It does so because it contains appropriate levels of material at the correct density. When stool floats, particularly when it floats and appears greasy, oily, or difficult to flush despite flushing twice, it is carrying excess fat. This condition is called steatorrhea, and it is the direct consequence of pancreatic lipase deficiency. When the pancreas fails to produce adequate lipase, dietary fat passes through the small intestine undigested and is expelled in the stool. The significance of steatorrhea goes beyond the visual characteristic. Fat-soluble vitamins, specifically vitamins A, D, E, and K, require dietary fat and pancreatic lipase for absorption. When fat is not being absorbed properly, these vitamins are being lost in the stool alongside the undigested fat. After the age of 65, vitamin D deficiency is already nearly universal. In adults with steatorrhea, vitamin D deficiency becomes profound and is associated with dramatically accelerated bone loss, immune dysfunction, and cancer risk amplification. A study from the American Journal of Gastroenterology found that adults over 65 with confirmed steatorrhea had a 73% rate of severe vitamin D deficiency and a 58% rate of vitamin K deficiency. Both deficiencies independently accelerated cancer progression in the presence of existing malignancy. Implementation: if you have seen floating, greasy, or difficult to flush stools more than occasionally, reduce dietary fat temporarily to identify whether this worsens the floating characteristic and request pancreatic enzyme testing. Synergy tip: supplementing with pancreatic enzyme replacement therapy, which requires a physician prescription, has been shown in a study from the European Journal of Gastroenterology to normalize fat absorption within 4 weeks in adults with documented pancreatic exocrine insufficiency. If this information is giving you clarity today, please hit that like button. And if you have not yet subscribed, please join this community. I publish evidence-based content for adults in their 60s, 70s, and beyond every single week, completely free. Subscribe and ring that bell. Sign number 2: upper abdominal pain that radiates to the back after eating. I want to be direct with you about this sign because it is the one that appears most commonly in the medical record for 1 to 2 years before a pancreatic cancer diagnosis, and it is routinely attributed to other causes. Upper abdominal pain, specifically in the area between the sternum and the navel, that begins 20 to 45 minutes after eating and radiates through to the middle back, is the characteristic pain pattern of pancreatic inflammation or mass effect. The reason this pain pattern is so specific to pancreatic pathology is anatomical. The pancreas lies behind the stomach against the posterior abdominal wall. When it is inflamed or when a mass within it creates pressure, that pressure is felt anteriorly in the upper abdomen and posteriorly in the mid-back simultaneously. The post-meal timing occurs because eating stimulates pancreatic secretion, which increases pressure in an already inflamed or obstructed system. After age 65, the clinical significance of this pain pattern is amplified because the two most serious causes, chronic pancreatitis and pancreatic adenocarcinoma, both increase dramatically in incidence with advancing age. Pancreatic cancer is most commonly diagnosed between ages 65 and 79, and its 5-year survival rate is only 11%, largely because it is diagnosed late after symptoms have been present for months or years. A study from MD Anderson Cancer Center found that adults over 65 who reported upper abdominal pain radiating to the back with onset after eating, who received pancreatic imaging within 30 days of symptom onset, had treatment outcomes that were 3 times better than those in whom investigation was delayed beyond 3 months. Practical implementation: if you have experienced this specific pain pattern on more than 3 occasions in the past 2 months, request an abdominal CT with pancreatic protocol or an endoscopic ultrasound from your physician specifically, not a general ultrasound. Pancreatic protocol imaging. Synergy tip: an anti-inflammatory dietary approach reduces pancreatic inflammation between episodes. Specifically, eliminating alcohol completely, even social drinking, has been shown in a study from Johns Hopkins to reduce recurrent pancreatitis episodes by 64%. No amount of alcohol is safe for a pancreas that is already inflamed. Meet Dolores, 70 years old, a retired physical therapist from Austin, Texas. Dolores had been experiencing upper abdominal pain after meals for 14 months. She had been told it was likely gastroesophageal reflux and was given a proton pump inhibitor that provided no relief. When she finally came to see me, I reviewed her symptom pattern. The pain onset timing, the back radiation, the post-meal relationship were textbook pancreatic. I ordered imaging the same week. Her scan revealed a 2-centimeter pancreatic mass. She was in surgery within 3 weeks. Her surgeon told her that catching it at 2 centimeters versus the more typical presentation at 4 to 5 centimeters had dramatically improved her prognosis. Dolores is 3 years cancer-free today. She sends me a card every year on her surgery anniversary. The last one said simply, "Thank you for listening differently. It's never too late to ask for the right test. It is never too late to advocate for a different diagnosis." And now sign number 1. the most critical, most specific, most urgent toilet sign that demands immediate evaluation without any delay. Dark, reddish-brown stool that is not explained by what you have eaten. The medical term for blood in the stool that has been partially digested is melena, and it produces stool that appears black, dark, reddish-brown, or tar-like with a distinctive odor that is more pungent than normal. When blood originates from the upper gastrointestinal tract, which includes the stomach and upper small intestine adjacent to the pancreatic duct, it is digested by the time it reaches the rectum, turning dark. Dark or tarry stool in an adult over 60 is a gastrointestinal emergency. It indicates bleeding somewhere in the upper digestive tract, and in the context of other signs on this list, it may indicate erosion of a vessel by a pancreatic mass, pancreatic duct bleeding, or severe acute pancreatitis causing vascular damage. A study from the Journal of Emergency Medicine found that adults over 65 with new onset dark or tarry stool had a 67% rate of identifying significant upper GI pathology on urgent endoscopy. This is not a wait-and-see sign. This is a same-day emergency department visit sign. If you see dark tarry or significantly reddish-brown stool that is not explained by iron supplementation or consuming large amounts of beets or black licorice, you go to urgent care or the emergency department today. I want to speak to you directly for a moment. I understand that this is not a comfortable conversation. Most of us are conditioned to ignore what we flush away, but your body is communicating with you through every biological process, and digestion is among the loudest channels it uses. Your pancreas does not have a pain receptor, it activates early. It does not set off an alarm, it changes your digestion. And now you know what those changes look like. Look. It is never too late to start paying attention. It is never too late to ask your doctor for a test you were never told to request. It is never, ever too late to catch something while there is still time to do something about it. Share this video with someone who has been experiencing digestive changes and dismissing them as normal aging. You may be giving them the knowledge that prompts the test that saves their life. Leave a comment right now with your age and whether any of these signs were something you had noticed without understanding. I will be here reading every word. Subscribe for more evidence-based content that is specific to your life at 60, 70, and beyond. I am Dr. William Lee, and I will see you in the next video. Take care of yourself. Your pancreas is depending on you. I want to spend a moment on the psychological dimension of this conversation before I close, because the topic of digestive health and specifically of what you observe in the toilet carries a level of social embarrassment that causes people to delay conversations that are clinically urgent. Let me say this as plainly as I can. Every physician in gastroenterology, oncology, and internal medicine has these conversations every single day. What you see in the toilet is not a topic that makes your physician uncomfortable. It is a topic they need you to bring up because it is one of the richest sources of diagnostic information available, and patients consistently fail to volunteer it. The next time you are in your physician's office, for any reason, practice saying these exact words. I have noticed some changes in my stool, and I want to describe them to you. That sentence opens a conversation that might otherwise never happen. Describe the color, the consistency, the floating or sinking, the foaming, the odor, the frequency, and how long you have been observing the changes. Your physician will ask follow-up questions. You will answer them. And from that conversation, clinical decisions will be made that would never have been made if you had stayed silent. A study from the Annals of Gastroenterology found that over 60% of adults over 60 who were ultimately diagnosed with pancreatic or biliary disease had noticed relevant stool changes for an average of 14 months before mentioning them to a physician. 14 months. In a disease like pancreatic cancer, 14 months is the difference between surgical candidacy and palliative care. The embarrassment that caused that delay is understandable, and it is also correctable. You have now been given the specific language and the specific observations to bring to your next appointment. Use them. Your digestive system has been communicating with you your entire life. The sensations, the urgency, the changes in character, all of it is information. Most of it is benign information. Some of it, the signs I described today, is information that demands action. The difference between those categories is now much clearer to you than it was before this video. Use that clarity. Bring it to your next appointment. Bring it to the conversation with your spouse or your adult child who has been encouraging you to see a doctor. And bring it to the decision you make today about whether to call and schedule an appointment you have been putting off. It is never too late. Not at 63 like Norbert was when his signs began. Not at 70 like Dolores was when she finally got the right imaging. Not at any age where the body is still sending you signals and you still have the capacity to respond. Your pancreas has been quiet for a long time. It is asking for your attention now. Give it that attention. It is worth it. You are worth it. I also want to give you one practical tool before you close this video, a simple monthly self-check for the 5 signs I described today. On the first of every month, spend 5 minutes in intentional observation. Note whether your urine has shown any foaming in the past 30 days. Note whether your stool has shown any pale, clay, or floating characteristics. Note whether you have experienced any upper abdominal pain that radiates to the back after meals. Note whether your skin around your eyes or the backs of your hands has shown unusual puffiness in the morning. And note whether you have experienced any unexplained itching or metallic taste in your mouth. Write these observations down, 5 lines, one for each sign, with a simple present or absent notation. Date the entry. Do this every month. Within 6 months, you will have a longitudinal record of your pancreatic and digestive health that is more informative to your physician than any single appointment could provide. If a sign appears that was not present in previous months, that emergence is itself clinically significant information. You have created the timeline that gives your doctor context. This 5-minute monthly check is the kind of proactive health monitoring that the healthcare system does not have the infrastructure to provide for you, but you can provide it for yourself. And the information you gather will make every physician encounter you have more productive, more targeted, and more likely to result in appropriate early evaluation when it matters most. It is never too late to become an excellent observer of your own health. It is never too late to give your doctors the information they need to protect you. Start your first entry tonight. Share this video with someone who has been experiencing digestive changes and dismissing them. Leave a comment with your age. It is never too late to pay attention. It is never too late to make the call. Your pancreas is worth the conversation. Share this video with someone who has been experiencing any of these signs and calling it normal aging. Leave me a comment right now with your age and one observation about your own digestive health that this video helped you understand differently. Your words matter. This community grows stronger when people share honestly. I am here. Subscribe, share, ring that bell, and take care of yourself. Your pancreas is worth every conversation it takes to protect it.